It's River to River from IPR News. I'm Ben Kiefer. Iowa is designated by the EPA as an entirely Zone 1 state for radon. What does that mean? At least half of all homes here are estimated to exceed the federal action level for radon gas. Nearly three-quarters of Iowa homes have tested high, and yet most Iowans have never tested their home and may never have heard of radon at all. Radon is colorless, odorless, and radioactive. It seeps up from the soil and accumulates indoors, and long-term exposure is the leading cause of lung cancer among people who have never smoked. In Iowa, it contributes to an estimated 400 lung cancer deaths every year. So today we're looking at the radon problem in our state, what it is, why it's so pronounced here, and what's being done about it, and what you can do to protect yourself and your family. Later in the hour, Dr. Richard Deming will join us, Medical Director of the MercyOne Richard Deming Cancer Center in Des Moines. Also, Juliann Van Liew, Director of the Polk County Health Department. And we'll also hear from Stacy Haas of Marion County Public Health about a new statewide initiative that aims to put free radon test kits into 30,000 Iowa homes this fall, and build the workforce of licensed mitigators to help when tests come back high. But let's begin with someone who has lived this story firsthand. Maria Steele spent 40 years in healthcare, working as a nurse practitioner the last 20. She had no prescriptions her entire adult life, had never smoked, and had no obvious risk factors for lung cancer. Then, in the weeks before Christmas 2019, that changed. A persistent cough led to a chest X-ray, a CT scan, a biopsy, and a diagnosis of stage 4 lung cancer. The likely culprit, radon. Since her diagnosis, Maria has become an active voice for radon awareness and lung cancer policy at the Iowa State House. I spoke with her recently. Hi, Maria.
Thank you so much for having me.
Walk me back to late 2019. What were you noticing that made you finally go and get checked out? That cough, right?
The cough, I had some heaviness in my chest. I had kind of a wheezing sound and decreased stamina when I was out walking. Initially didn't think a lot of it. It was winter. You're walking outside in winter. You think you're going to be a little more tired, but it really persisted. And my husband really encouraged me to finally go see someone for this. I'd already been through a cardiac workup thinking, maybe the heaviness in my chest is something like that because I had a family history, but it was all negative. So I never suspected lung issues at all.
You're a nurse practitioner with 40 years in healthcare. When the results came back, what a blow. How did that professional knowledge as a nurse practitioner interact with the personal shock of what you were hearing?
Yeah, it was shock, and it was overwhelming. The first thing, it was on a Wednesday evening, and I had received the results, and first thing we did was talk it over with my husband, Pat, and we called our kids, and it was just unbelievable. And the first question is, why lung cancer? There's no family history. It just didn't make sense to me, but I knew I had to find out more.
Yeah. And I understand, I said stage 4. It moved from stage 3 to stage 4 as more was learned. Walk us through that progression.
So when I was in a week before Christmas, I had the CT scan and the biopsy, and I really wanted to know what the biopsy results showed. So the physician was kind enough to tell me that I was at stage 3. However, he said with lung cancer, it's most commonly will spread to the brain, bones, and liver. So you need a PET scan to see where the active cancer cells are, and you need a brain MRI to see if there's any activity in the brain. And unfortunately, there was. And if you have brain metastasis, you go right to stage 4, and your prognosis goes down.
How widespread was it in your body, your brain?
It was in my brain. There were 6 lesions in my brain. I had a painful rib, so the bone metastasis. That was the only thing that bothered me, but it had also been in my spine and a little bit in my pelvis.
Yeah. Okay, describe the treatment. You had radiation treatment to your brain, to your bones?
Yes. So cyberknife radiation is very targeted therapy. I saw Dr. Deming at the Richard Deming Cancer Center. And I think the worst thing about it, honestly, was being literally, they formed a mask. You're laying on your back. They form a mask to your face, and you have to lie there for 30 minutes knowing that a laser is going into your brain. And so they were able to treat 2 lesions at a time. So I was there every day, 3 days in a row. I was a wreck. I requested some sedation because I just didn't know if I could do it. It's just such an experience that I had never had before. It was frightening. Thankfully, didn't have a lot of side effects from it, but the experience was really tough.
And your status right now, are you cancer-free? This is what?
I would love to say that.
7 years?
6.5 years. I would love to say that. However, just this month I had some additional scans and found that it has spread more in my lungs and in my pelvis.
I'm so sorry, Maria.
I literally found out last week that I would need a new treatment. I've had radiation to my pelvis in 24 because I was having some pain, and that took care of it. And then, again, this was routine surveillance, and in the last 6 months it spread. So with targeted therapy, and I learned a lot about targeted therapy and biomarker testing, even being in healthcare, I feel like that helped me a great deal. So this new treatment, I had a second opinion at the University of Iowa. I can say all the wonderful things about my treatment here in the Des Moines area, but when it came to the potential of being on new treatment, I did request a second opinion at the University of Iowa, and she and my local physician both recommend a new treatment that was just approved in December as an injection as opposed to an infusion. The potential for more side effects is there. I've tolerated the oral targeted therapy that I've had for the last 6.5 years. I've tolerated it pretty well with some progression and treatment, but this is just this month. It was a great deal more, so I need to up the level of treatment, and so it'll be an injection weekly, and then a new pill that'll start if I'm tolerating the injection. So there's a new detour in the journey, as I say.
Yeah, we wish you all the very best going forward. You have been an active voice for radon awareness and lung cancer policy ever since your first diagnosis, that first battle with cancer. When did radon enter the conversation as a likely cause?
That's a great question, because as a nurse, I had heard of radon, but I did not know the prevalence of radon, and I didn't realize that it was the number 2 cause of cancer overall, and then the number 1 cause of lung cancer if you're a non-smoker. But the prevalence in Iowa was where I was the most surprised, to be honest. And as you said, 3/4 of Iowa homes have high indoor radon levels. So, after I'm diagnosed, I'm reading about it on the internet, of course, and doing my own research. And I learned about a woman named Gail Orcutt. She had stage 4 lung cancer and did not have high risk factors. And she was an educator, and she really promoted radon testing in schools. And she died in May of 22. And then the Gail Orcutt School Safety Radon Bill was passed in 22 and was named after her. So I had read about her, and she had been up at the State House for 10 years advocating for this. And I remember feeling shocked that why would that take so long? Why is that something that we're even discussing? Radon should be tested. So that led to other things, and I had a lot of help with my advocacy work. There's so many organizations that are willing to step up and help talk to legislators and influence policy in a prevention sort of way, which is a lot less expensive than, I can't even tell you how much all my cancer treatments and medication has cost. Other than I do know when I was first treated, the first month of pills I saw from the pharmacy was $35,000 a month for a pill to take every day. And you're on lifelong treatment because, as Dr. Deming told me, he said, you're inoperable and you're incurable, but we're going to treat this like a chronic disease. There are new things coming out. We're going to treat this like a chronic disease, and we're going to keep a close eye on you. And as a healthcare professional, I get chronic disease. So, and I get the importance of follow-up and the importance of, self-advocacy, really, and the importance of advocating for others and speaking for others, which has probably motivated me to do this.
Mm-hmm. You've done many years of advocacy, awareness raising about radon and cancer policy. You tested your home, I understand, after your diagnosis. What did you find?
It was double what it should be. I went to the local hardware store in Adel. Kits readily available. At the time, $12. And so I tested our home. Then you send in the results. You get results online a couple of weeks later. Again, it was double, so I thought, I've lived in Iowa my whole life. Maybe I'll go to a different hardware store, get a different kit, which I actually did, and waited a week and tested again, and it was still high. So this is, winter in Iowa, so doors are closed, windows are shut, which is how you're supposed to test in the lowest level of your home. So
that was my next question. It was at the lowest level, the basement.
Yes, that's where you're supposed to test. Now, some homes don't. The lowest livable area. So I grew up in a home with a 3-foot dirt crawl space. So that's not your livable area. So you would put it, if you were testing my childhood home, on the first floor.
We're going to take a break, and we'll be right back with more from Maria Steele. Maria is a retired nurse practitioner of 4 decades, also a lung cancer survivor. We're hearing her story today. We're focused on radon, colorless, odorless, radioactive. It seeps up from the soil, accumulates indoors. Long-term exposure is the leading cause of lung cancer among people who have never smoked. In Iowa, it contributes to an estimated 400 lung cancer deaths every year. And so we're so grateful for Maria to come in, continuing her advocacy work, awareness raising. We'll be back with Maria in just a moment. It's River to River from IPR News. Back with more River to River from IPR News. I'm Ben Kiefer. Let's get back to a recent conversation with Maria Steele, lung cancer survivor, worked for 4 decades in the medical field, most recently as a nurse practitioner. We're hearing the story of her cancer diagnosis in 2019, and most recently that cancer has come back. She's being treated for that. Maria, a lot of Iowans probably don't know that nearly 3/4 of Iowa homes have tested above the EPA action level. What was your reaction when you learned the scope of it? I mean, you said, what did you say a few minutes ago, that you'd never really, even as a nurse, never really paid attention to radon, and now you're thrust into it with your cancer diagnosis, and you become super aware of how widespread it is. What is your reaction?
Hyper-aware is a great way to put it, because, again, with nursing, it's all about patient education and patient advocacy and all that. And one of my first thoughts was, I'm overwhelmed, how is this happening? You find out that radon is so important, especially in Iowa. Then it's like, we need to get the word out. And I feel like I had this mentor in Gail Orchid, even though I never met her. She has so many interviews that are still online that I listen to, YouTube videos, and I thought, she did this for 10 years. She had a lung removed. She had a hip replaced for bone metastasis, and she's still up there. So, if I'm, still able to, I want to help people too. I mean, that's why most people go into healthcare and nursing, is to help people. And if you can't help them physically, then at least do it via advocacy and education.
Right. Let's talk a little bit more about policy and advocacy. Iowa passed legislation requiring passive radon mitigation systems in new construction. How significant is that win? And to tell us, what does a passive system actually do?
It's an extremely significant win. There's more to be done, but this is a start. So the passive system, you basically put in, I'll call it plumbing. In our home, it was a 4-inch PVC pipe. I watched the guy install it, and that's retrofitting. But a passive system, you basically have all that PVC pipe in place, and even the fact that you don't have a fan in operation, it is assumed that at least some of the subflooring, it'll come up through that PVC pipe and go out into the outside air because, of course, the toxic radon gas is diluted in the environment. And so the goal is that once, and this is a new construction, the passive system is a new construction. It goes into effect July 1st. The goal is that when a person moves into a new home, they should wait 6 months, test it, and, again, doors closed, window, everything closed up, test it, and if it's still high, then they only have to pay for a fan to be installed, which is minimal compared to retrofitting a home. We paid over $1,200 6.5 years ago, and we got in fairly quickly. I have friends who have been waiting 6 months to get their mitigation system put in after they know it's high. So I was happy to hear that we're going to be working on getting more licensed mitigators in the state of Iowa.
Let's talk about the Gail Orcutt Testing Act, because it covers Iowa public schools, but not all schools. Explain the gap there and why it matters.
That's very disappointing to me because all school children and all educators should be safe. So I'm thrilled. We were thrilled that it passed for public schools, but you have private schools. I'm a product of Dowling Catholic School. I don't know if they've tested their school. I hope so. And actually homeschool kids, their homes should be tested. So, and again, I'll throw in the educators. Our daughter is an educator in Waukee schools. I want her safe while she's there. So, but again, that's a public school. But it's too bad there's a disconnect.
Right. Let's talk about homes again, because we talked about passive systems in new constructions. Right now, Iowa doesn't require radon testing when a home is sold. Also, apartment dwellers. You've raised that particular vulnerability of renters in your advocacy because that depends on building owners to address that possible radon hazard, right?
Exactly. And my understanding is that, I wish I knew how Iowa City did this. Iowa City is the only city in Iowa that requires all residences, apartments, homes to be tested and mitigated if the levels are high.
Mm-hmm. In your advocacy, also at the State House, what is barring this? It seems like you said something to the effect on like a no-brainer that we know this causes lung cancer, second only to smoking, and yet we can't mandate some of the things that would make absolute sense. What's standing in the way, in your opinion?
Well, something I learned early on in my advocacy work is some legislators hate the term mandate. They think people should be in control of their own destiny and they shouldn't have to do anything. Well, that's not common sense. If we know for a fact that radon can cause lung cancer and that we know the entire state is red from an EPA standpoint, we mandate seatbelts, we mandate guardrails. This is prevention that will help people not to get it, and then not the cost of treatment, and not only financial cost, the emotional cost of treatment, not only the patients, but their families.
Maria, as we finish up this conversation, for someone listening right now who has never tested their home, some words of wisdom, because we have undoubtedly families there, and especially if anybody in the family is sleeping in the lower level, that would be of special concern. Children in a built-out basement or something like that, spending a lot of time. What do you tell them?
I would tell them to go to any hardware store. I think the kits run about $20. Get a kit, test your home. The instructions are easy. It's not that expensive. And then if it is high, to contact a certified mitigator and get on the books to have it done. My hope is that our legislators will give tax incentives and tax breaks to people for mitigation systems. That's a whole other level of advocacy. But it's vital, and I wish I would have known about it sooner, because I would have tested our home the minute I realized how significant radon was in Iowa. And don't wait. I was just talking to somebody the other day, and they still hadn't tested their home. I just shook my head and I said, please do it for your children and grandchildren. It's so important. Don't make them go through what I've been going through.
Maria Steele, lung cancer survivor, speaking out, raising awareness about the dangers of radon and the easy way to have it mitigated, tested and mitigated if you have a problem. Maria, thank you so much for coming into our studio. We wish you the very best. That conversation recorded with Maria last week. It's River to River from IPR News. I'm Ben Kiefer, now live, and 3/4 of Iowa homes have tested high. Most Iowans have never tested their home, though, and many have never heard of radon gas at all. So this hour is dedicated to this obvious hazard that we are trying to mitigate. Radon, colorless, odorless, radioactive, naturally occurring, seeps up from the soil, accumulates indoors, and long-term exposure is the leading cause of lung cancer among people who have never smoked, contributing to an estimated 400 lung cancer deaths every year. Let's welcome Dr. Richard Deming to our program, Medical Director of the MercyOne Richard Deming Cancer Center in Des Moines. He's one of Iowa's leading cancer specialists. He was also, as you heard, the oncologist for Maria Steele, our first guest. Dr. Deming, welcome to the program.
Thanks so much, Ben. What an honor to be on, and how inspired I always am when I hear Maria talk.
Yes, she is truly a treasure to have out there to advocate and raise awareness. We want to mention, too, that Cultivating Compassion, the Dr. Richard Deming Foundation, is a financial supporter of IPR. So we're having you here to speak to the science of radon as a carcinogen, Iowa's particular geological vulnerability for radon, lung cancer treatment, the public policy landscape, all those things. You also knew Gail Orcutt, whose patients, she's a patient whose advocacy led to the school radon testing law that now bears her name. And we'd like to have our listeners join in our conversation. Questions about radon, the radon cancer connection, and how to reduce your risk. 1-866-780-9100, River to River at iowapublicradio.org. All right, for listeners joining us, give us the scientific grounding. Help us understand a little bit more, Dr. Deming. What is radon? Where does it come from? And how does it cause lung cancer?
Yes, so we here in Iowa and actually the upper Midwest sit on the biggest collection of radon. Radon is naturally occurring. It's not a man-made pollutant. And the way the earth was made back in the Ice Age and the glaciers coming down from Canada kind of pulverized the granite and created dust that then became incorporated in the land of the upper Midwest, where we do a lot of farming and it's covered by very porous soil. So the uranium that was in the stone gets ground up and is present beneath the soil. And from the uranium comes through radioactive decay, that is where one radioactive isotope becomes other isotopes, eventually creates radon, and as you mentioned, a colorless, odorless radioactive gas that then can come up through the soil. It can actually involve the air in addition to the soil and water. So not only air coming up through our homes, but also groundwater, and particularly concerning in wells. Once it gets into rivers, streams, and lakes, the concentration is usually small enough that it isn't a particular concern. We know from studies there's absolutely an increased risk of developing cancer if you're exposed to radon. And the level that is considered acceptable is less than 4 picocurie per liter. The average home in Iowa has about 8 picocurie per liter. So a lot of exposure in Iowa. And we know that individuals that are exposed to that level of radon have up to 20 times more risk of developing lung cancer than individuals not exposed. Those that are particularly susceptible to lung cancer are individuals who smoke and are exposed to higher risks of radon. As Maria said, neither Gail nor Maria were smokers but lived in homes with a high radon. The ones that are really at high risk are cigarette smokers who live with a high radon content. Lung cancer isn't the only cancer that is caused by radon. It is the most the cancer that has the highest incidence. It causes more deaths than any other cancer in Iowa. But other cancers have also been associated with radon, and that includes stomach cancer and melanomas, to name two. There's also some evidence that other cancers and potentially leukemias and lymphomas might also be at increased risk with exposure to radon.
So this is really low-hanging fruit. We know the connection between radon, high radon levels in homes or businesses, wherever that might be, long-term exposure, and the cancer risk there. Dr. Deming, it's been 20 years since I had my house mitigated. It was right in that average that you named. Something like 8 or 9 was what our basement tested for in the wintertime, closed winter conditions. We had a mitigation system put in, and it worked wonderfully. Our readings are less than 1 now.
Yes, it's as you mentioned, low-hanging fruit for several reasons. One, we know the association, and there's no real debate over cause and effect. Number two, it's easy to test, and it's very inexpensive, and you can do it yourself. And number three, mitigation is within the reach of most people in terms of expense, and more we're having other resources to help individuals who may not be able to. And then the big point is this is preventing cancer. So when you talk about public health, the best thing is to prevent disease from happening. Second best is to detect it at an early level. And we can talk about, lung cancer screening, which is underutilized and could help detect lung cancer at an early stage. But we're talking about prevention. And that's really where public health shines in terms of making a huge difference in the public health of Iowans.
You knew Gail Orcutt as a patient. Tell us about her and what she did to get radon testing into Iowa schools. That's a first step. We still have many public policy steps we could take, don't we?
Yes. Well, thank you for asking me to reflect on Gail. It is so nice to remember her. She was diagnosed with lung cancer in 2010. She was 57 years old, a lifelong educator, and she presented also with a cough. When her cancer was initially found, it was thought to be localized to her lung. It was a rather large tumor in her lung, so she had to have her entire left lung removed, but was thought to be then cancer-free. In 2013, it was found to be metastatic in her bones, so stage 4. She lived on targeted therapy. So like Maria, both of them had mutated cancer cells for which there is a oral targeted therapy. So in Gail's case, she had ALK mutation, and Maria has an EGFR mutation. But both of those you don't find out unless your tissue is sent in for biomarker testing, which is standard now, but wouldn't have been exactly standard back in 2010. So they both were fortunate to have many, many years of very good life on oral targeted therapy. And I am hopeful and optimistic Maria has decades more life to do the work she's doing. But like many individuals who come through the cancer journey, they use their wisdom not just to illuminate their own path forward, but to help others. And that's what Gail did. She joined the American Cancer Society Cancer Action Network, the lobbying arm, the American Lung Association lobbying arm, and we were arm in arm up at the Capitol year after year advocating for public policy to reduce the cancer burden caused by radon. So year after year, she would educate legislators and would rally for the school safety bill.
We have to go to a break in just a moment. But could you list quickly in the final minute here, Dr. Deming, if you're talking to Iowa legislators, and listeners can put pressure on their own legislators here, what's the next policy priority on radon and lung cancer? Just list at this point because we have less than a minute.
Well, one would be that every time there's a transaction of a home, existing home, that's an opportunity to do testing and mitigation. The new law is about new construction. The logical next step would be selling a pre-existing home and using that opportunity to test.
Right, and I think Iowa City already has that, but we would love to have that statewide, Dr. Deming. Stay with us. Dr. Richard Deming, Medical Director of the MercyOne Richard Deming Cancer Center. When we come back, we'll talk more about the cancer and radon connection and how easy it is to remove that hazard from your house if it does exist. 1-866-780-9100, River to River at iowapublicradio.org. Back in just a moment. Back with more River to River from IPR News. I'm Ben Kiefer with Dr. Richard Deming, Medical Director of the MercyOne Richard Deming Cancer Center. Today, it's all about radon and the connection to lung cancer. Radon gas, naturally occurring, colorless, odorless, radioactive, seeps up from the soil, accumulates indoors. Long-term exposure can lead to, is a leading cause of lung cancer among people who have never smoked. And Iowa, in the unenviable position of being a state with a lot of geology that releases radon gas. And Richard, we had a caller here, left a message, wanted to have you go over what is the safe level of radon that you could find in your home.
That is under 4 picocurie per liter. But as with all substances that increase the risk of cancer, it's not like that's a threshold and that you're absolutely safe below that level. So with radiation exposure, it's always a matter of time, distance, and shielding. And so, but that level is considered relatively safe. And as I mentioned earlier, the average level in homes in Iowa is 8 picocurie per liter.
Right, and if you go outside, I think I was told less than 1 would be in the outdoors. That would be normal.
Yes, obviously there is radon in the atmosphere outdoors, but because of it is quickly diluted, so the concentration that an individual inhales outdoors in nature is quite low.
Mm-hmm. Let's add to our conversation Juliann Van Liew. Juliann is the Polk County Health Department Director, and she comes to this conversation not just as a public health professional, but as someone who recently went through radon testing and mitigation in her own home as well. Hi, Juliann.
Thanks for having me here. I appreciate this focus on this public health issue.
Well, we appreciate you. You've been a driving force, I understand, behind a newly launched Polk County Cancer Coalition. First of all, how does a public health director think about radon differently than, say, a clinician or an individual homeowner? What's on your radar first and foremost?
Sure. I appreciate Dr. Deming and our other guests because they've really brought the public health lens already, which is fantastic. He's one of those clinicians that really sees the bigger picture. But it is a little bit of a different angle for us in public health. We're responsible really for population-wide outcomes. We're looking at incidence and prevalence of cancers. We're looking at how those shift over time for different demographics. While we're not really focused on the individual person, because that's the role of our healthcare providers, but when we have something that's as impactful as radon, it really becomes a public health issue when we can do shared mitigation strategies. So it's one of those things, as folks have mentioned, that is highly preventable. And so we see that in public health as a huge opportunity for us to step in and use those proven and tried public health practices to try to move the needle on a wide scale.
You have skin in the game, I guess I'll say lungs in the game here, because you went through some radon testing and mitigation yourself. What did you find and what made you decide to act?
Sure. So, with knowledge comes a responsibility to act, and that's true as a public health professional, but also as a mom of young kids. I did do testing, and mine came back at just below that 4 PCI per liter limit. Interestingly enough, my parents live on the street behind me. We share back fence line, and theirs were 3 or 4 times higher than mine was, and those are homes just next door to one another. So I want to highlight that for folks that there can be wide variation from one home to the next, even on the same block.
Dr. Deming, such an important point. Jump in on there, because let's say you're in a house and you hear from your neighbors on the right and the left, they have low radon levels. That does not mean you're safe. You have to get tested.
That's correct. You need to get tested, and you also should retest periodically. Some would recommend that you maybe test several times during the year at different times of the year because in the wintertime, when everything is sealed up for weeks at a time, the level might be much higher than in the summertime when all the windows are open.
Mm-hmm. And there are electronic devices. They run, I think, a little bit over $100. I have one in my basement for peace of mind to keep a constant track of the radon levels in the house. It's periodically giving those tests all the time. Let's go to Walt in Cedar Rapids, 1-866-780-9100, river to river at iowapublicradio.org. Walt, thank you for coming on to our conversation. What's on your mind?
I have a question on well water. You have private well, farm wells and that sort of thing. If there's more incidence of radon through the well water, or if it could be, absorbed through the well water, and then when you turn on the faucet, it would emit the gas or cause you more radon exposure.
Good question. Dr. Deming, can we have you comment on that?
Yes, you're absolutely right. Well water is at a greater risk than surface water. And so here in Des Moines, as I understand it, we get most of our water from the rivers, and by the time you're flowing in the river, any radon that would have come in from the ground usually has been already mitigated. But yes, well water is at higher risk, and there is a way of testing water for radon content.
Okay. Let me go back to Juliann Van Liew of Polk County. We're running out of time, and I want to make sure you get to what's going on in Polk County, that you're driving to get the low-hanging fruit, to get those houses, homes, businesses, whatever, tested so that we can get that mitigation and avoid future cancer cases.
Absolutely. And, you're seeing health departments across the state really step into this space right now, partly because it is kind of a natural space for us in terms of prevention, partly because of the success of the 99 Counties project, where we've, gotten on the road and shared across the state some of these cancer-related outcomes. But what we're doing right now is putting together the Polk County Cancer Coalition, which will take strategies from the Iowa Cancer Plan, figure out what's most important here, given our health outcomes, and identifying strategies specific to Polk. But again, a lot of folks are doing this across the state. And what's so important is that power comes through collective action. And so the ability for us to make changes, even on something, straightforward like radon, is really amplified when we have different sectors talking about it, when we have employers and schools and others talking about it. Yeah. And then when we have folks willing to put in funds and resources to help create a sort of a mitigation fund is something else we also
Right. I wanted to speak to
on.
that because mitigation can run $800 to $1,500 or more, depending on the type of house you have, the build, the foundation. For families who can't absorb that cost, what options exist or should exist, Juliann?
Sure. Yeah, there are not strong options right now. I will tell you we're working on bringing together government and private money to try to put something together in Polk County, because this is really the heart of the inequities and where those come from, is that it's really great to educate people. It's even better if they screen and test, but it's not going to do anything in terms of changing those outcomes if we then don't support folks in doing that mitigation. Mm-hmm. And as was mentioned, that can be $800, $1,000, $1,500, which is out of reach for a lot of folks in our communities in urban and rural spaces. So that's one of the biggest things we need to kind of come to terms with and become a priority, because without concerted funding for this, it will be difficult for so many people to access what they need.
$1,000 or $2,000 is a lot of money, but such a small fraction, Dr. Deming, when you compare what that cancer treatment costs these days, right?
Yes, prevention is always less expensive than treatment.
Okay. Let's include Stacy Haas with us as well at the end of this program manager for the Combat Cancer Initiative at Marion County Public Health. That's a program that receives a Rural Transformation Grant through the Iowa Department of Health and Human Services. Stacy, welcome to our program.
Thank you. Thank you for having me.
I understand your initiative takes a three-part approach to radon. Run through those quickly, please.
Yeah, so we identified that there are multiple components when we're looking to provide mitigation. That first component is across the state, we have very limited numbers of individuals that are licensed to provide the mitigation work. And so our first goal through our Combat Cancer Initiative in rural Iowa is to identify individuals that might be like to become licensed. And so we're offering scholarships to individuals to help pay the cost of taking the course as well as getting licensed. And so we're looking to identify individuals to complete those processes.
Right, and talk about, and just to throw in here, in case it's not obvious, Stacy, talk about a career choice that is not going to be outsourced to any foreign country and which will guaranteed have, work for decades to come, right?
Yes, there's new homes going up all the time, and there's also homes that are going to need continued, mitigation efforts, throughout the years and, times to come.
Yeah, right. So the second, you're also expanding access to these free home testing kits. Tell us about that.
Yes, so we know one of the first, levels of that kind of, knowledge into action is, being able to educate individuals about the importance of testing in their home. And so we want to make testing accessible to Iowans across the state, and so we are going to be making tests available for free across the state and all rural counties in Iowa for individuals to be able to go to their public health office and collect a free test to test their home, so that they can do that in their home in the months to come.
Yeah. So you have a test in your home, you get a bad result, maybe you take another test to make sure that that's confirmed. You are also, Stacy, in the business of connecting Iowans who have bad results, need mitigation with financial assistance to get it done. Where are you at there?
Yeah, so just as Juliann said, an individual, just because they identify a test that's high, if they don't have the funds to be able to provide that mitigation effort, we're not making progress. And so we're looking to, in addition to not only providing free tests, also assist individuals with elevated numbers be able to receive financial assistance to get their homes mitigated.
Mm-hmm. Would it make sense then to, Dr. Deming, to you, let's say, you're financially pinched, you want to get things done, you have a radon test that comes out bad, you might have people in your lower level where you took the test spending a lot of time in your family, maybe there's a bedroom down there. You want to, as soon as possible, get people out of the most affected area. Would that be correct?
That is true. I mean, that's one form of mitigation, time, distance shielding. I'm really excited that we're making progress, though, toward having more funds to mitigate. In fact, remembering Gail Orcott again, not only did she fight and advocate, but in her death, her surviving spouse, Bill, set up a fund at the Community Foundation to help those individuals. Now, it's relatively small. It's not going to mitigate everybody, but there are people who use the wisdom they gain from their journey and help others. And so there are other funds, and as Juliann said, they're looking to make it a bit more organized, and obviously with the funds that are coming to Marion County, they have the ability with a larger amount of funds to have funds available with means testing to those individuals who have tested high but don't have the resources to actually do the mitigation.
Mm-hmm. What does the radon problem look like, Stacy, specifically in rural Iowa? Because that, as in many issues, poses some extra challenges, doesn't it?
Yes, and so one of the biggest challenges we found was connecting individuals to an individual that can provide the work. And so most of our mitigators are located in more of an urban type setting, and so we go multiple counties without individuals that are able to provide those efforts. And then we also have older homes that have never been tested, and we also have those socioeconomic issues for individuals in rural settings.
Mm-hmm. Okay, we're coming up to the end of the hour. I want to make sure we have some actionable information here for those whose awareness has been raised so that they know where to go. Let's start with you, Juliann. What for someone anywhere in Iowa, rural or urban, they may be hearing about radon for the first time. What do you want them to do? Where do they go to find out more?
Sure. So your local health department is a great spot, of course. Iowa HHS, the Iowa Cancer Consortium, all of those kind of statewide places have great access to information. At the Polk County Health Department, we provide radon test kits for $15, but folks can really get those online. You can find the reputable sources, and don't be afraid to use those. The other thing I want to really encourage for folks is what's most meaningful for people in terms of coming on board and doing something is when someone else in their direct circle talks to them about it. Mm-hmm. So go out, get your tests, test your own home, and then have a conversation with a neighbor and make sure they do as well.
Right, and you can see these radon mitigation systems on houses. They're usually white PVC pipes, 3 or 4 inches in diameter, going up the side of a house. Dan in Albion says, I have an active radon mitigation system. Great job there, Dan. He asks, though, do I need to keep testing for radon? Dr. Deming, you do need to periodically, even though you have a mitigation system.
Yes, I would recommend that you do continue to test. I mean, there are things that can go wrong with any mechanical or physical object. So chances are that he won't have to do any further mitigation, but it's an inexpensive test would reassure him that his mitigation system is still working.
Okay. Stacy Haas, so what else do you want to drive home in our final minute?
Yes, I think in our final minutes here is it's important to test. That individuals do have access if there are financial barriers. We don't want that to be a factor for an individual to test their home, and that we're looking for people to join the efforts in helping combat radon across the state.
Mm-hmm. And Dr. Deming, tell us, what are the messages you have for lawmakers and those in our electorate who could talk to lawmakers and put a little pressure on it for the coming session?
Yes, public policy can save millions of lives. As a doctor, I have the opportunity to reduce the burden of cancer sort of 1/2 hour at a time, one patient at a time. But as a public servant, you have the ability to save hundreds of thousands of lives, and use that ability, and you will feel good about that.
Mm-hmm. What is your hope, Dr. Deming, for how much of a dent we will make in terms of reducing this radon hazard, especially unique to our state?
One of the good things about being second in the nation in terms of cancer incidence is it's got everyone paying attention, and that brings people together regardless of what political stripe, to do what needs to be done. We know there are so many things we can do to help prevent cancers that are preventable, encourage more screening of cancers so they can be cured, and make sure that everyone has access to health care.
Dr. Richard Deming, thank you so much. Maria Steele was on earlier. Thanks for her advocacy. Juliann Van Liew and Stacy Haas, thank you all for being on this program. Today's show produced by Caitlin Troutman, technical help from Nev Kelly, John Pemble, Tony Sarabia, and Catherine Perkins. I'm Ben Kiefer. Thanks for joining us.
I'm Tony Sarabia. Well, it came down to the penalty shots, and as a result, Germany, the Netherlands out, Japan out, talking about the knockout round of the World Cup. We'll get an update coming up on Here and Now, much more between 1 and 3 o'clock. So stay with us. It's 12:59. It's IPR News.
Support for IPR comes from Linder Tire Service. 92 years of serving Eastern Iowa. 3 locations in North Liberty, Iowa City, and Grinnell, specializing in all tire